Hi everybody, my name is Alyssa Patterson, and today you are going to be hearing from myself, Rachel Markle, and Brianna Thunderberg on the quality of end-of-life care, which in this case is hospice. So to start off, here's a little overview of what we are going to be talking about. I'm going to be talking about the history and the benefits of the hospice care system in the United States. Rachel will be talking about the cost and accessibility of hospice care, and Brianna will be talking about the impact of hospice on volunteers and workers. So you might be asking yourself, what is hospice? So hospice is a care service that is given to people who are terminally ill or dying. The service offers support and comfort for the terminally ill or dying and their families. And according to Johns Hopkins Medical Center, for somebody to qualify for hospice, they have to have a life expectancy of 6 months or less, or they have to be in the process of dying. The hospice system has been around for a very long time in the United States, but it originally started way back around 4 AD when monasteries in Europe had opened their doors to people who were very ill. But in the United States, hospice did not start until about 1963 when Florence Wald, who was an American nurse and Dean of Yale School of Nursing, founded the first hospice center in the United States. The first hospice center in the world was at St. Christopher's in England. St. Christopher's was run by Dr. Seeley Saunders. Some of the first hospice centers in the United States were run by volunteers, but in the 1980s, Medicare authorized hospice for formal care, and this became, and because of this, hospice became a reasonable choice for end-of-life care, according to Simon Habeel. And in 1991, under Medicare, hospice also became available to military. Hospice has been the preferred treatment for the terminally ill in the United States for the past 50 or so years, and there are many different types of hospice, whether it be in your home, in hospitals, or nursing facilities. Personally, my great-grandma was on hospice 2 years ago, and hers is in a nursing facility, and I work in healthcare, and a lot of my residents are on hospice, and most of them are in nursing homes. The goal of hospice. The goal of most hospice centers are to try to help reduce the emotional, physical, and spiritual sufferings of the patient or the family that they might be going through. I know it can be really hard on families. It was really hard on my family to see my great-grandma go on hospice, but they made the transition so much easier, and they were always there, and they really did a good job. Hospice can provide a lot of services to their patients and families. Some of the services include routine medical assessments, spiritual counseling, and frequent nurse visits. And the sicker the patient seems, the more the nurse will visit and change routines or medications based on how far along the process is. And obviously, these aren't all of the services that hospice provides, but I feel like these are the important ones. There are a lot of benefits that hospice provides as well. For example, one of the benefits is freedom of choice. This means that the patient gives or has a choice on how they want to end their end-of-life care to be. Like I said, I work in the healthcare industry, and I know that a lot of my residents who choose hospice seem to be confident and content with knowing how they will be treated towards their end of life. And I also see that their families are content with knowing what is going to be happening to them. Another benefit is that the hospice workers are available 24/7. So this means that, let's say your loved one gets sick in the middle of the night, 2 or 3 a.m., you could call the nurse who's on call, and they would be there in about 30 minutes to help take care of them. And one more benefit of hospice is that it provides emotional support for the patient, but even for the family. They are there to support and help make decisions about the end of life care, as well as just being a shoulder to cry on and comfort them on this difficult time. And this is all according to the Center for Hospice Care. I know that when my great-grandma was dying, her hospice nurses were very sweet to my family, and when she ended up passing away, they did come to the funeral, and they're always there for us. You know, they called my grandparents a lot, and they talked to them, and just, like, they always are there to catch you up on stuff, and they're there for a shoulder to cry on, like I said. I know my family turned to them a lot, and they really do help make the best decisions for your loved one. There are also 4 levels of the hospice care system. So level 1 is called routine home care. At this level, all the basic needs can be provided from anywhere, including like your home, a hospital, nursing home, hospice facility, and so on. This includes volunteer visits, medication, and social and spiritual services as well. The second level is called continuous home care. At this level, the nurse is with the patient for longer periods of time, instead of just visiting them when needed. Also at this level, if there was a medical crisis, the nurse or physician can make decisions for the dying patient. The third level is called general inpatient care, and at this level, the nurse or the physician can suggest that the loved one who is ill will be moved to an inpatient hospice center if their symptoms tend to get worse. Some of these symptoms include shortness of breath or unrelieved pain. And the fourth and final level is called respite care. And at this level, it can only be provided at a hospice certified center or a place that has round-the-clock nursing care. And at my work, I work at an assisted living facility, which is basically a nursing home. And I do have a lot of residents who are on hospice and can stay at our facility because we do have round-the-clock nursing, and I'm like a caregiver, so I'm there to like help just relieve their pain. That could either be by moving them or telling the nurse that they need medication or even like calling hospice. With all of these options that hospice provides, it tends to be what people lean towards when they have to choose their end-of-life care. I know personally that I would definitely choose hospice for my end-of-life care. But hospice can be very beneficial to many because of its long history and the goals that they have, and I think this is why many people choose to go on hospice. Now I'm going to pass it on to Rachel.